Good morning and welcome to today's session of Imagine America Radio, our continuing Career College Exposition webinar series. My name is Bob Martin. I'm the President and CEO of the Imagine America Foundation. Joining me on today's session of Imagine America Radio is my foundation colleague, Lee Doubleday. Lee and I are extremely excited about today's career topic, College for Healthcare Careers with Rasmussen University. Rasmussen University is an institution of higher education dedicated to global enrichment and meeting the evolving needs of the diverse communities that they serve. With an emphasis on innovative programs, dynamic curriculum, and general education skills, they are committed to being a leader in the field of career-focused education. Rasmussen University is also a brand new partner of the Imagine America Scholarship Program. Your students can now apply for a scholarship to attend Rasmussen University through our foundation. If you'd like more information on our scholarship programs and how your students can apply, you can either contact me or Lee Doubleday at the foundation after this presentation, or you can visit our website at www.imagine-america.org. Since our beginning in 1999, Imagine America remains the leading sponsor of scholarship aid to enrolling high school seniors. However, our country faces a serious shortage in certified technicians. We hear from employers in virtually all corners of the United States desperately looking for qualified employees. We need to do more. Our partner in today's presentation is Rasmussen University. Joining us today to discuss the detailed looming technician shortage and how Rasmussen University is helping meet those needs is Nana Asi Bansu, forgive me. Nana has been working in admissions for over 5 years. Before turning the program over to Nana, let me very quickly go over today's agenda. Today's session of Imagine America Radio will be 30 minutes maximum with questions and answers. Once we finish these remarks, we're going to move directly into today's presentation. All participants can submit questions while the presentation is in session via the Q&A feature in this Zoom meeting. At the end of the presentation, or approximately 10:25, we're going to turn this over to questions that will be offered from the participants. We will address as many questions as possible and provide written responses in follow-up emails to all participants. We will have a hard close at 10:30 a.m. So without taking out any more time from our presentation, let me turn the program over to Nana. Nana, the floor is yours.
Thank you very much, Bob, and thank you as well, Lee. Hello, everyone. Happy Thursday. My name is Nana Bansu, and as Bob introduced, I am with the admissions team for the Orlando campus right here in the sunny state of Florida. I'm glad everyone's able to make it this Thursday. A little bit about myself. I've actually been with Rasmussen again for about 5 years, and having the ability to work with students directly and helping them figure out the best program they're interested in, talking to them a little bit about their career dreams and where they see themselves working in a number of years, and really helping them get through the enrollment process so that they can actually start school. We have a one-step model here at Rasmussen University, and we want to always focus on supporting the student. Today's talk is really to instill what a post-secondary education is all about, why it's so important, really relating to the healthcare industry. And so we're a little bit about our agenda. We're going to focus on workforce trends and really discuss the importance of that secondary education, where we discuss a little bit about weekly earnings and unemployment rates. That'll tie into the ever so growing healthcare industry and kind of the shift from Health 1.0 to Health 3.0. And then we're going to discuss the healthcare education options. And that's where it's going to be important for you as counselors and teachers to be able to pinpoint those students that are really passionate about the healthcare industry. Some students don't know about all the opportunities and programs that are available, and we have a plethora of them here at Rasmussen University. Now, that will also tie into a little bit about that one-stop model that we have here at Rasmussen, and a little bit about our history, and that'll leave just enough time for questions as well. Okay, so let's go ahead and get started and talk a little bit more about the workforce trends. Now, I know we always have that age-old conversation with our students, which is, what program are you interested in? What college are you interested in going into? And what do you kind of see yourself doing once you get done with high school? Sometimes that student has a great answer, which is, I know I want to go into this program and I know I want to attend this college. And then you have some students that say, I'm not sure which program I want to go into, but I know I do want to get my associates or my bachelor's. And then you have that student sometimes say, I just want to enter the workforce. I'm not really looking to go into getting a degree. I just want to go straight into the workforce. Now, regardless of what that response is, as administrators and counselors, we want to always give that student the understanding that a post-secondary education is really important. And based on the information pulled from the US Bureau of Labor Statistics, this information really sticks out into their minds, where they can see that the life after high school should include education. So based on the figure on the left, based on median weekly earnings by education level, you can see that a student that has less than a high school diploma or a high school diploma is actually earning less in earnings each week than a student that has an associate's or bachelor's degree. And that kind of jumps out at students sometimes when they see those figures and they're thinking, what, I really don't necessarily need that degree or need that training. I just want to go straight into the workforce. This kind of jumps out a little bit for them to see, well, maybe I should go and get my degree because potentially I can earn more weekly. Now, it also, on the flip side, shows, well, how do I maintain that employment as well? And as you can see here, for a student that has an associate's or bachelor's degree, the percentage of unemployment rate is a lot lower than a student with less than a high school diploma or a high school diploma. So it's really important that our students understand that, and they really can grasp the opportunities and programs here at Rasmussen University. Now, the talk today is really focused on the healthcare care industry. And we know that, there's a plethora of programs available at Rasmussen, but we wanted to focus on this industry specifically because of the projected job growth. Now, based on the Bureau of Labor Statistics, it shows that the healthcare industry occupations is growing at a rate of 15%. About 2.4 million new jobs will be available between now and 2029. That is a huge percentage, especially on average. Some industries are growing anywhere from 5 to 8%, which is considered good. Healthcare is growing at 15%. And as you can see, at all other occupations currently do that same time frame, it's about 4%. So for those high school students that are interested in working directly with patients, or maybe wanting to be in a supportive role in the healthcare industry and thinking about just giving back to the community health-wise, we want them to know that there's plenty of opportunity here at Rasmussen University to take a look at a variety of the programs that are available. Now, it's also based on how the industry actually is today, the shift that has actually happened. And that leads us to understanding where the healthcare industry is today. Now, some of us may have experienced this, or maybe our parents or grandparents, where it was all about the patient and the provider relationship, right? They gave birth to you. You went to the same pediatrician or doctor that gave birth to your children, and you really focus all of your information from that one provider. Now, we understand that the relationship and the quality of care was really great at that time during Health 1.0, but it also didn't allow for you as the patient to get more information on other opinions from other doctors, because you really only went to one person. Now the shift to big medicine where health 2.0 comes in, and now information is made available. There's a plethora of resources from Google and WebMD and so much that's available for you to learn more about your own health, that now you might go out for a second or third opinion. Now that part is really important. However, it didn't leave enough time for you and your doctor to really discuss what was happening to you. Um, Sessions that would normally last, appointments that would last about 30 minutes are now down to about 19 minutes. And it's because now your doctors and providers have to actually input information about you and make sure they're keeping the right data so that if you are transferring that information to another doctor, they're capable of doing that. And there's a lot, and there's all accuracies as well. But that is not a great blend of what is needed for the patient because the quality of care is not there. So now we're at Health 3.0. And this is where the quadruple aim comes in, where it's not just about the better patient experience, it's not just about lowering healthcare costs, but it's a combination of also not burning out our providers and also always having that higher quality of care. And it really changed the dynamic of having a team to work to assist each and every patient that walks into the offices or calls their insurance to make sure they're getting the best quality and assistance that is possible. Now, that teamwork comes from, yes, that face to face, that direct patient care aspect first, but there's so many indirect patient care opportunities that are there. And I want to actually focus on that a little bit because for some of your students that are passionate about healthcare and thinking about going into a health profession, they are maybe thinking about maybe going into medicine, maybe becoming that nurse, maybe they want to do medical assisting, or they want to do something that is more face to face with the patient. But there's so many opportunities as well for those students that really don't like blood or don't want to necessarily be in that patient room or actually talk directly with the patient, where the indirect patient care programs are careers are available. Now, these are different careers that you can launch in as few as 2 years or less. So I want to make sure that for you as counselors and talking to your high school students, that they really can open and expand their mind to really different opportunities that are available when it comes to healthcare careers. And that leads me to the various programs at Rasmussen University. Now, we have programs stemming from diplomas and certificates to associate's degree to bachelor's, master's based programs, and also doctorate programs as well. Now, for that student that is coming straight out of high school and is thinking about, you know what, I'm trying to just get my feet wet. Maybe I just want to figure out what I want to do in the healthcare industry, but I'm not specifically sure, but I know it's something relating to healthcare, where they can actually go into a diploma-based program where they can complete that in as few as 9 to 12 months. From there, that student can ladder into an associate's degree where they can complete that in as few as 18 to 24 months. And then eventually going into their bachelor's right after, where they can actually complete that in as few as 18 to 24 months. So the student really has entire plan of programs that they can go into and lead into, starting from our diplomas. Now, as you see from the diploma programs that are available for the state of Florida, you have students that may be interested in becoming LPNs and getting their practical nursing diploma. Eventually, they can go into an RN to a LPN to RN bridge program where they can go into their associates or go into a BSN, and then eventually go and get that RN to BSN afterwards. You also have those students that are really passionate about medical assisting and working in that realm. But then you have those students that are interested, and again, the supportive roles as well. So for those students that are thinking about medical billing and coding and inputting information and making sure insurance is billed the right way, that kind of student may be passionate about, working with systems so they can ladder into a health information technician program where now they're not just managing the billing side of things, but all information that is readily available to be inputted in these systems. Well, from there, they might be thinking, you know what, now that I've completed this program and I've gotten my RHIT, maybe I want to manage. So now they're looking at our bachelor's degree where they're going into health information management. They're not just managing the systems, but they're also managing people. And that also leads to those students that may not want to work in terms of information, but they want to be able to provide it to the community. That's where human services comes in, and where that student can either go in and get their associate's or bachelor's degree in human services. Maybe you have that student that really is passionate about wellness and really taking care of their body. That's where health and wellness comes in. So your students really have the ability to choose from a variety of programs here at Rasmussen University. And I want to make sure that they also understand what that hard skills that they're learning, how important they are, but then also the soft skills that they will be learning that ties everybody together. Now, this information was pulled from LinkedIn. In 2018, it was a survey done of 2,000 business leaders, and 57% of business leaders say that soft skills are more important than hard skills. So it's not just about the day-to-day processes and working with the systems, but it's those other transferable skills that really ties the team together to make sure that the office or working with the patient or just the information as a whole is done properly. And that starts with the communication piece, the ability to write, read, and communicate both verbally and non-verbally is so important in tying a team together. Understanding that critical thinking component, having that problem solving and having creative ways to make sure things are efficient. Digital fluency. If this pandemic hasn't taught us about using Zoom and using more WebEx meetings, having more ability to utilize information and the emails and different technologies to transfer data, that I don't know what would. It's so important that we learn how to use those digital tools, but then doing it ethically and having that professional responsibility, doing everything with integrity, making sure things are right and providing the most accurate information. But transferable skills also has to do with that teamwork, right? Diversity is a huge topic right now. Understanding how to work with different genders, different races, different professional backgrounds, tying together as one to make sure that that company or making sure that the health industry is moving effectively, but also learning how to use that information properly as well, right? How to evaluate and effectively use information is so key. This is why we moved from Health 1.0 now to Health 3.0. So your students are getting just what they need to be able to move into their industry and be able to jump directly into the career paths that they're pursuing at our university. Now, our model is helps your student really guide them through exactly and what they want and what they need. And that starts with our support team, the dedicated advisors that are available. Someone like myself, who is an admissions manager, which started off as an admissions advisor, speaking with your students directly, helping answer their questions, help them figure out which industry, then really which program best works for them, assisting them with getting their enrollment documents and figuring out financing for school, then ultimately handing them off to their advisors that's going to assist them throughout their entire time there in the program. It's not just the student figuring things out on their own, but they have someone dedicated that they can always reach out to get those questions answered. even as a student, and they're discussing financial aid and figuring out their coursework and making sure that they're, answering their assignments properly. And for those students that maybe need some additional resources like the library and learning services to help them with MLA or APA writing, peer mentoring and online tutoring, writing labs that are available, 24 hours a day, 7 days a week, tech support, so that if something goes down, they have someone they can reach out to as a student. All of that is built here in Rasmussen University to make sure that your student always has some guidance and assistance through their program. Now, once they're done and getting ready to embark on their journey of working and start really launching their career, that's where career services also comes in, where we are assisting our students with interviewing techniques, building their resume, learning how to use those resources to apply to jobs. This is all important to make sure that your student has really all of the guidance that is available and resources to launch their program and then ultimately graduate and get into their career. And that's really based on the philosophy of Walter Rasmussen when he founded the college in September of 1900, based on the premise of bringing a practical career focused education to the classroom. Now, we have been able to expand from the state of Minnesota now to 6 different states. And here in Florida, we have campuses in Ocala, Central Pasco, Fort Myers, Tampa, and now Orlando. Orlando actually opened up in November of 2018. And across all of our campuses, there are 23 of them, by the way, and an online campus as well. We actually have 7 areas of study with 50 plus programs, and we have areas of study in nursing, justice studies. Maybe that student is passionate about early childhood education. Maybe you have a student that's interested in technology or maybe designing and graphic design. Maybe you have that business students that's thinking about finance and or thinking about just business as a whole. We have a plethora of programs in each one of those schools as well. So it's not only about the healthcare industry that we discussed today, but it's just a variety of programs that are available at Rasmussen University for your high school students. And of course, we are regionally accredited by the Higher Learning Commission as well. So the quality of the program stamp of approval is there. Now, why are we here today? Well, the importance of understanding the post-secondary education is there, but also to discuss how your student can utilize the Imagine America Scholarship to attend Rasmussen University. We have partnered with Imagine America Foundation, and we are offering a $1,000 Imagine American scholarship for those 2021 high school graduates that have a 2.5 GPA or above. Now, for that student that is interested in Rasmussen University and applying for this scholarship, they can actually visit the Imagine America website or download the mobile app to apply. Rasmussen University and Imagine America will partner up and notify that recipient. Okay, so for your students, when you're having those dedicated conversations about the future and that age-old question that we talked about earlier, we want you to be able to provide them with some information about our university and also this scholarship because it can be beneficial to them as well. Now, if for more information on Rasmussen University and also the Imagine America Foundation Scholarship, you can actually visit rasmussen.edu and take a look at our plethora of programs and a little bit more about our history. You can also reach me directly. My email and phone number is on the screen. And let's partner up and assist your high school student in imagining their futures with a quality education with Rasmussen University and Imagine America Foundation. Thank you very much for all of your time, and I'll open it up for questions.
Hey, great job, Nana. We really, excellent presentation. Thank you. Let's go into the Q&A section of this presentation. The first one that we got back is, even though you talked about the scholarship portion and the overall qualifications for the Imagine America Scholarship. How does GPA or SAT scores, if they do at all, how does it fit into the admissions process at Rasmussen?
Oh, great question. For students that attend Rasmussen University, GPA, SAT scores, HCT scores do not affect the enrollment process. It's not actually something, a guideline that we actually use to evaluate students. We have our own ready assessment that a student would take when they enroll into our program. That will assist us in figuring out which program, which courses that student would take in their first quarter. So the GPA, the ACTs, none of those actually come into factor into the enrollment process.
Yeah, they only come into effect if they're looking for the scholarship based upon those recommendations you outlined.
That is
Now,
correct.
second one has to do with housing. Are there housing options for your students around your campuses?
We don't have housing specifically at our campus. We do have a facility for classes. Students would typically find apartments that are in the area or throughout Orlando.
Okay.
They would actually do that part on their own.
The third question, Nana, comes from the Orlando area. It has to do with programmatic and cost comparisons with traditional community colleges. How does it all stack up? Because it can be a little bit confusing because you're quicker. In other words, your programs are a little bit quicker, a little bit more accelerated, might be a tad bit more, but that's offset by the other factors. Can you want to talk about that a little bit?
Absolutely. For a lot of the traditional based programs that are here in this area, the student actually is really focused on doing things on their own. They're applying on their own. They're taking their SATs. They're filling out their applications. They're figuring out their own financial aid. They're really all by themselves, even sometimes even throughout their actual program. Our one-stop model allows our students to really have that dedicated person to help guide them through the enrollment process, guide them through their education, guide them in career services and figuring out their next steps into their careers. So that is a major difference. When you're looking at the cost, though those programs may be slightly cheaper, our program does give that student that immediate attention and education that they'll need to finish their programs quickly, to really advance into their careers quickly as well. So
Yeah.
to help
Well,
answer that question.
I didn't mean to interrupt you, Nana. So,
No, no.
but if you have, if any of the participants on this call have a highly motivated individual that has an understanding of the career area they want to go into, and they want to get it done and get doing it, if you would, for lack of a better way of putting it, Rasmussen University might be a pretty good opportunity for them to look at.
Oh, absolutely. Because that student graduating in May has the ability to start school immediately in July. They do not have to wait for a fall or a January start, especially when you're looking at students that are interested in healthcare or nursing. A lot of those students are passionate about really jumping directly into their education so they can get out and start working in their industry. Students don't actually have to wait at all to start their programs. They have the ability to get done with their previous education and start enrolling into that next start, which is typically a couple months later. So
And
that
they can be
allows
out,
the students to start immediately and be out a lot faster as well.
yeah, and they can be out and working in their chosen field in 12 to 18 months. I'm thinking, right? Is that
That
fair?
is correct.
Yeah,
That is
that's a very important differentiator now that you brought out that is really important to our audience. The next question has to do with again coming from Orlando. If we have a participant on the call that wants to talk to one of your local representatives, is it best for them to go to the website, or should they contact you directly?
They can actually contact me directly. I am actually specifically at the Orlando campus. If we have any administrators that are on the call that are from the other areas, they can still reach out to me. I can direct them specifically to someone at the campus that will assist them the same way I would in Orlando.
Perfect. So you can be the kind of point of departure, or you can be the one that refers them out.
Absolutely.
Okay. Let me very quickly, if I could, just go through a few housekeeping matters before we close off today's session. The Manage America Foundation is compiling and will forward a complete set of all questions that we received and talked about here with Nana, or any ones that come in subsequently, and we'll send those out to all registrants. Second, we've recorded this session, and we're going to be forwarding this recording to all the registrants and a very targeted group of other interested parties of and around those campuses of Rasmussen University. Foundation is going to be placing this session on our website. For those of you that may not know that, it's www.imagine-america.org with very specific download instructions. And the reason that's important is because when you sit back in your office and you remember something that Nana may have said, and you're trying to get a better context of it, going back to the recording, listening to it again will give you the ability to ask those questions, or at least get those questions formulated so you can call Nana. Finally, my colleague Lee Doubleday is going to be conducting a survey to determine possible topics and locations for future webinars. We're going to be sending that survey out to all the participants. We really urge you to take opportunity to give us some feedback on what you think and how we might be able to better serve or help you and your students. Before closing, I'd like to thank the participants, the counselors, the teachers, the instructors for taking time out of their very busy schedules today to join us. We know how busy you are. We know how hectic your schedules are. We know the demands that are being placed on you. Just normally, forget about the COVID-19 situation. We know that, we appreciate it. And we really, really appreciate you taking and carving out just a few minutes of time to listen to today's presentation. We'd also at Imagine America would like to thank Nana Osebasu for joining us today and sharing an excellent presentation on healthcare careers, and would encourage you to contact him directly on any questions you may have about the presentation, about Rasmussen University, or just in general, anything else about this career. On behalf of the Imagine America Foundation, Lee Doubleday, Nana, and myself, we want to thank you and hope you have a great day. Goodbye.